Find out how to use a scraping tool for mommy's thumb, gamer's thumbs, otherwise known as the Quervain syndrome. Hi, I'm Dr. Justin Lin, chronic pain physical therapist at Rehab and Revive. I'll show you the how-tos next. So how do you know you have gamer's thumb, mommy's thumb, de Quervain's? There's an easy test. It's called the Finkelstein Test. And I'm just going to show you right now. Basically what you want to do is hook your thumb into your finger, into your other fingers and kind of tuck it away. And then you're going to gently pull down. Now, if you feel a pulling, a stretching pain, there's likely inflammation. This is a Tenosynovitis type of thing. And so you basically want to just check that. And I'll kind of show you off the side a little bit. It's to tuck it in and you want to go out generally with your elbow straight. If it's painful or pulling, for me, there's nothing going on right here. So that's the key here. So you want to do this test. And if this isn't totally positive, you can still try this exercise, but it may not be the right one for you. So once again, you want to tuck it in, pull it down. And if it's an ouchie, then that's no good. The big things about this strategy is how I do the strokes. I've talked about it in other massage gun videos. I've talked about it in even some of the other scraping videos, where you do the stroke, whether it's away from the origin, which is to basically to deactivate or kind of like inhibit is another word, or to pull it towards the origin of these tendons and muscles, actually activates it even more or strengthens it for that kind of short period of time. It's very much a neuromuscular or very much a neuro type of process that is going on that kind of makes this ability better. So when someone has de Quervain syndrome, mommy's thumb, gamer's thumb, typer's thumb, cell phone thumb, whatever you want to whatever thumb, it's inflamed. And usually it's basically an inflammation of the tendon or the tendon sheath of the abductor, pollicis, and then the extensor, pollicis brevis, which is, sitting right around here. So these things generally just get short because you're using it all the time. If you're holding a baby, if you're playing video games on your cell phone, or just kind of doing games and stuff like that. So you're always moving these short muscles. In essence, it needs to be the other ones that help the other muscles around, especially the extensors. They're stronger to facilitate and distribute the stress you're imparting with your thumbs. So without further ado, we're going to use the Ached Away mini scraper. We can link the promo code for $25 off this scraper. We love using this. You can use the back of a spoon, use any old scraper, to be honest. I love this because it's got a heating function. It vibrates, and it's just easier handheld than maybe some of the other things you might use. But just being able to just kind of use it broadly is the goal. So with mommy's thumb, you want to start inhibiting. And a lot of times because we're typing so much and holding, gripping, these need to be released. So just very blanket. I'm setting this at a little bit of heat so it feels nice. You don't want to keep it in one place, but you're basically just stroking it down. And so I'm going away. I'm not going back and forth. I'm not going frivolously or aimlessly. It's very intentional. So I'm just basically stroking it from this elbow crease. Sometimes you can even get higher because some of these tendons attach higher. You want to go towards the wrist. You can even go towards the palm if you want. And you can see it's starting to kind of put some circulation and flow back into these. So I'm just going to do this a little bit longer. I could set it on a desk. I don't have a desk right in front of me right now, but I'm just basically trying to use in just probably like 30 seconds worth. So let's do this already. And I could tell you it's already a little bit more mobile. Then the next thing is to strengthen or facilitate the extensors. Because these are your bad boys. These are, we use them for golf and baseball and stuff like that. Power stroke for hammering, possibly. So these are powerful muscles. You want to get these activated. That's why you want to kind of get underneath these bad boys and I like to angle it this way, by the way, like a little, you could do it this way, but like I said, I'm not scraping aimlessly. I'm just bringing it up, bringing it up, bringing it up, bringing it up, bringing it up. Your goal is to decrease that inflammation as quick as possible. The longer you're in that state, the breakdown is going to continue to happen. And then you have breakdown and inflammation, and then so on and so forth, that vicious cycle. So right here, I'm loving the heat on this, and the vibrating makes it easier. And then I'm gonna get all the way kind of towards this bone, and then there. That's usually a guy that really gets here. There we go. So it gets a little bit smoother. And so let's do that test again. And I can tell you it's easier. So now the very target that you want to lengthen it. Oftentimes it gets caught up in a little sheath, or retinaculum is what it is. Carpal tunnel, in other words, as well, kind of wraps itself around. You want to just lengthen it, and I kind of do it with motion. So I do this, and right there, and I do that. It almost like runs into a stopping point. Like I said, I don't have inflammation right now, but I'm sure I'm set up for it, or this is something I can do to prevent, since I use my hands treating patients all the time. So there we go. Feels good. I just kind of sit on it and then just let it stroke. So a lot of you who work with your hands, carpenters, typers, gamers, just do that. So now you can see I can kind of do that and lengthen it. Kind of do that. And then I can work here too. Lengthen it, lengthen it. So I'm basically lengthening it and pushing away. I'm not doing this crazy. It's just very sequenced, very intentional. Good. And there. Yep. Now it's starting to feel good. I can kind of do it across this muscle too. That helps. The index finger muscle, the pointer finger. Obviously, oftentimes we're just using this together, right? So good. So let's take a look again, and you can see this one goes much easier. And so once again, it's stroke downwards, downwards, upwards, lengthen. So that's as basic as it's going to get. Let us know your thoughts on our scraping video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Justin Lin. Remember, we heal smarter.